Michigan has identified dozens of PFAS-contaminated sites around the state. Michigan officials called a state of emergency over water in Kalamazoo County. It's yet another site on a growing list of those around the state contaminated with the chemicals PFAS or PFOA. The industrial chemicals, known as polyfluoroalkyl and perfluoroalkyl substances or PFAS, have been linked to a variety of adverse health effects, including liver damage, thyroid disease, decreased fertility, high cholesterol, obesity, hormone suppression and cancer. On Friday, county officials warned the approximately 3,100 residents of Parchment and nearby Cooper Township that are served by the municipal water system to stop using the water for drinking, cooking, or to mix baby formula. Local officials said the water can be used for showering, laundry and flushing toilets. Parchment's water supply will be drained and continued to be flushed until test results come back that shows the PFAS levels are below the health advisory level, according to a news release from the Kalamazoo County government. The state declaration of emergency allows for the Michigan State Police Emergency Management and Homeland Security Division to coordinate state efforts with local and county officials. This declaration will allow the state to supply additional resources to help with response efforts and ensure the health and safety of residents in Parchment and Cooper Township, Michigan. Lieutenant Governor Brian Kelly said in a statement. Kalamazoo County is one of 34 PFAS-contaminated sites identified since statewide testing of water systems began in March, according to state officials. Other sites include the municipal water system of Ann Arbor, as well as the Battle Creek area. People should be concerned. PFAS belongs to a family of chemicals that also include PFOA and Gen X. Introduced more than 60 years ago, PFAS are a category of man-made chemicals that degrade very slowly, if at all, in the environment. The chemicals have been used for decades on military bases and in industrial areas in the manufacturing of thousands of consumer items, such as food packaging materials, fabrics, non-stick cooking pans and firefighting foams. While PFOA and PFAS are no longer manufactured in the US, they continue to be found in the environment. I think that people should be concerned about the amount of PFOA and PFAS that is in our environment, Susan M. Finney, a professor in the Department of Environmental Health at the University of Cincinnati, wrote in an email. These are chemicals with long half-lives, meaning they persist in the environment as well as the body. Exposure in utero may have the greatest effect on developing children, and effects may last into adulthood, she said, adding that the science is still early. Finney said there are immediate things that can be done, including granular activated charcoal filtration systems which will remove much, although not all, of the PFOA. More research and information on the potential health effects of these chemicals, as well as improved detection systems, are needed, she said. In June, the Agency for Toxic Substances and Disease Registry, a division of the U.S. Department of Health and Human Services, released a draft report that recommended that PFAS and the related family of chemicals be much lower. The 800-plus page report determined that current EPA suggested limits are up to 10 times higher than they should be. The report is open to public comment until August 20. CNN's Michael Nadelman, Susan Scutti and Kevin Flower contributed to this report.